Black women are dying. I think I'm showing my age here, but I remember in my 20s, I don't know if y'all used to watch Girlfriends, but there was a documentary that Lynn was doing about AIDS in the black community, specifically the black women community. And I think it was called Black Women, Lives in the AIDS, Lives in the Balance, or something to the effect. But basically, she started it out with something like black women are dying and AIDS is their killer. And we are repeating that cycle. However, black women are dying and pregnancy is their killer. Something as simple, and I don't want to call it simple, but something as natural as being pregnant is killing black women. It's killing a lot of women, but it's killing black women more than it is killing any other race of women. The black maternal health crisis is in such dire straits right now that it is almost a death sentence to get pregnant. It is almost a death sentence to give birth. And that's crazy. We are one of the richest countries in the world. We have some of the best education as far as healthcare providers in the world. We have some of the most numerous amounts of resources, whether it be surgeries, whether it be instruments, whether it be Medicaid, just whatever. We have so many things in healthcare that allow us to help people prolong their life. And yet and still, we are killing black women who are only getting pregnant. They're not having heart attacks. They're not having diabetes. They're not having high cholesterol. They're not having cancer. Well, they are having cancer. It's killing people as well. But something as simple as pregnancy can be a death sentence now. And that is just mind-boggling, outrageous, and just bottom line unacceptable. One of the main reasons that I decided to become a women's health nurse practitioner is because black women like me are dying. Young black women are dying. Older black women are dying. Middle-aged black women are we are literally losing our lives to expand our family. And that is the wrong answer. That's the wrong answer. I get a little emotional when I think about it because I personally don't tell people that I'm in healthcare when I go to the doctor or whoever. When I have an encounter with the healthcare system, I don't even tell them that I'm a healthcare provider because I like to see how they treat people that they don't think know anything. And when I went in to have my baby, I had a fairly normal pregnancy. I was AMA, advanced maternal age, geriatric pregnancy, whatever kind of ridiculous name they like to give to women who have babies after 35, because I was 36 when I got pregnant, 37 when I had him. And I had a fairly normal pregnancy, a lot of morning sickness for the first 20 weeks. Well, the first 18 weeks. I had 2 weeks of relief, and then from 20 weeks on, I had Braxton Hicks, and I was contracting all the way up until I went into labor. And so, I had some liver issues going on, but other than that, it was very, what's the word I'm looking for? It was very, I'm having a brain fart. Anyway, it was uneventful. So when I went into labor and they were trying to do just simple things, like when I went into labor, they were trying to do my IV. I'm dehydrated all the time. My veins are small. And that's a bad combination when you're trying to give a large bore IV. And so I needed the IV for fluids because I was getting an epidural and they couldn't stick me. Three people tried. And then that last person put it in and half of the catheter was still out of my arm and she tried to tape it like that. And I was just looking, my husband is like, just tell them. And I'm like, is this what y'all do to regular people? Because this is the wrong answer. And so I didn't say anything until she taped it up. And then I said, do you think that's going to stay in? And her response to me was probably not. Then you're going to need to take that out and get someone who knows how to do an IV on a hard stick. The issue wasn't that you keep pricking. Well, the issue is that you keep pricking me. But the issue is that A, you keep pricking me, and B, you're going to leave this IV halfway in my arm, so the fluid is not going to get into the vein, and it's going to infiltrate, and then and it's just going to be something that it doesn't need to be. But somebody who didn't know that didn't look right wouldn't even know that it didn't look right. So they wouldn't even know that they were on the verge of possibly getting an infiltration and having, like, not being able to get the epidural, just whatever it could have turned into, like, just things that didn't need to happen. And so my husband's like, well, why didn't you just tell her? But I mean, by then I was like, listen, I am a nurse and I have worked in mother baby / L&D and pediatrics. So don't come with the bullshit, because I know what you're supposed to be doing. But I don't like to pull out that card, because as a nurse, when I have patients who, I worked in pediatrics and mother baby, but when I have patients or their family members who are like, I'm a nurse, to be snooty or whatever they're trying to be, it's annoying, because do you think I'm just the type of nurse who does right? So are you telling me that because you think now I'm going to correct myself? No, I just treat everybody the way I want them to treat my grandma or my own child. Like, that's just the kind of nurse that I am. So it's just like, okay, you're a nurse, but some people, you do have to tell them that, because then they operate in the manner that they're supposed to operate in. I don't like that. I don't like that for people who don't know any better and who don't know what's supposed to happen and who don't know, like, procedures are supposed to go on, and just simple things like correctly putting in an IV. Because if they weren't paying attention and they weren't looking and seeing that the IV wasn't incorrectly, then it just could have been bad. Not a death sentence per se, but it could have been bad. And so it's just, why would you do that? And so I just wanted to be a voice for people who don't know how to be a voice for themselves, or to be a voice for people who don't have anyone to advocate for them. Like, I used to have a women's intimate care brand. Like, I sold like feminine wash and orgasm cream, but I stopped doing that, A, because I wanted to focus on school, but B, because a lot of the things, like in my blogs and in my emails that I would send out, I would be educating people on things that obviously I know as a nurse, but that people I would think that it was common knowledge, and it's not. And a lot of people are in the comments in the blogs, they're responding to my emails or in my social media saying, thank you for that information. I never knew that. Nobody ever told me that about my period. Nobody ever told me that about menopause. Nobody ever told me that about just certain things. And I don't like that, because as healthcare providers, we need to be we're taught in school about education, whether that's nursing school, whether that is nurse practitioner school. I'm pretty sure they teach that in medical school, that you're supposed to be educating your patients on simple things. And so I was like, you know what? I got to get in here and do something about this Black maternal health crisis. I have got to get in here and help do something about this maternal health crisis in the Black community, because this is crazy. Because I am 41 and I do want to have another baby, but I don't want to risk my life for another baby. And I don't want to, for the sake of my child having a sibling, I don't want to risk my life so he can have a sibling over a mom. Like, it's just crazy that these are the kind of decisions and thinking that we have to have, because being pregnant and having a baby isn't just a simple process. It's literally, it can turn into a life or death situation. And not because there's something wrong with you, because you can go into the hospital perfectly healthy, just going into labor, and you can come out in a body bag, and that is the wrong answer. You can go into labor, have a very successful labor, have a very successful birth, have a very successful, first hour bonding with your child, and then you start getting pains in your legs, and you tell your nurses or your physician or whoever, nurse practitioner, whoever is in charge of you, you let them know, and they just write it off as, oh, that's normal. Oh, you're supposed to be cold. Oh, you're supposed to be sweating. You need to get up, so that's what's wrong. Whole time you have a blood clot. Whole time you have a blood clot, and then it turns into an embolism, which, just if you don't know, when an embolus moves, when a clot becomes mobile and moves, it becomes an embolus, and then it goes into your lungs and becomes a pulmonary embolism, and then you're dead. because they didn't take you seriously when that clot was in your leg before it had a chance to move up into your pulmonary artery. So it's just like, you don't have to be dead. If your healthcare providers pay attention to you, you don't have to be dead if you are listened to. And this really struck a nerve because I was on the Blue app, I think yesterday or the day before. And there's a young lady on there because there's so many of us that are becoming hashtags and are becoming social media stories. And especially now because they think that a 8-week-old embryo, not even that a 6-week-old fetus, and even worse now because they feel like a 7-week-old, 8-week-old embryo, not even crossing the threshold into fetus, but an embryo has more rights than the mother carrying that egg. Has more rights than the mother carrying that embryo. Are you for real right now? Because sometimes some people don't know that they're pregnant. You have the 6-week ban or whatever. Some people don't even know that they're pregnant at 6 weeks. I personally knew because, honey, I track. Because over here we just work on pull out and prayer. And so, but I track my body. I know when I'm ovulating. I know because I get the ovulation pain, but I know when I'm getting ready to ovulate. And I'll do a few videos so you can kind of understand the body and see what, if you want to track your cycle, then you can kind of know where you are in your menstrual cycle. But I know basically when I'm getting ready to ovulate. I have ovulation pain, so I know the day that I ovulate. And I know when my cycle is supposed to come on because literally 14 days after I get that ovulation pain is cycle day 1 and I'm on my period. And a lot of people don't know that, and that's okay. But so when I was pregnant, I knew at 4 weeks because my period is very reliable and she wasn't there. And I gave her 2 days. She did not show up. I was at the store buying a test and getting a pink line because I know. But a lot of people don't know. And it's not from their own. It's just, it's not taught like it should be. And it's just, some people are just not concerned about that. And that's neither here nor there. But the point is, you want people to know, you want people to not be able to do what they need to as far as birth control. Or you want people to not be able to have a choice about their bodies. And then you make them stay pregnant. And then you don't care for them when they're pregnant. And you don't care for them after they give birth and then they're dead. And that's just the wrong answer. And I don't like that. So I want to be able to help educate. I'm going to start this channel to just help women understand their body, not necessarily for pregnancy. It's a big aspect of it, but to help women understand their bodies and help women understand that they can advocate for themselves without being labeled aggressive or non-compliant or difficult or whatever other label they like to give people who like to not disagree with them or who like to get a second opinion, or, you know, they're whining, they're difficult because they're having symptoms that they're telling you about, and all of a sudden you don't believe them, so you think that they're drug seeking or you think that they are just whatever you're trying to label them as that day. But I came across this story on the Blue app and it just touched me because it's sad and it's really made me hone down on, that's really why I wanted to get into this field, because we got to do better. Like, we got to stop letting women die. We got to stop letting women suffer, in silence, because they don't trust the healthcare system, because I say y'all because I'm not a part of that. But because they treat us like trash, they disregard our feelings, they disregard our symptoms, they don't like to medicate us properly, they think we're drug seeking, they think that our bodies are made different, so they don't medicate us properly. They don't give us the correct dosages, they don't give us the correct medications because our bodies are built differently. And it's crazy because that has been proven scientifically that there's no biological difference between races. So you shouldn't be treating them based on their race. But that's another story for another day. But I saw this story. There's a young lady by the name of Shantara Brown, and I hope I'm saying that correctly, but her sister posted on Facebook on her behalf. And it says, "Hi, my name is Shantara Brown. I'm 32. January 28th, 2025, I was having pains in my stomach. I was also having bleeding from my vaginal area. I called the ambulance January 28th, 2025 at 6:55 a.m. and they said," and I quote, My symptoms are not good enough for an ambulance ride. I had to resort into taking a lift. I went to St. Charles Hospital and they diagnosed me with COVID and abdominal pain and sent me home. I'm still in school, but one of the actual tests that you are going to give a woman in childbearing years who has a uterus and working over one of the tests you're going to give a woman in her childbearing years who's complaining of abdominal pain is a pregnancy test. And depending on the results of that pregnancy test, we're going to do an ultrasound to see where the baby is, to make sure it's a uterine pregnancy. To make sure it's an intrauterine pregnancy and not an ectopic pregnancy, because you want to know where that egg is. But I digress. And sent me home. Diagnosed me with COVID and abdominal pain and sent me home. I continued to have these pains, so I went to ProMedica Hospital. They diagnosed me with a uterus pregnancy. They sent me home, but they did not check me thoroughly. I was having an ectopic pregnancy, which can be deadly if the baby grows too big. I continued to have these pains and called the ambulance and continued to get turned down for a ride to the hospital from January 28th to January 29th, 2025. I didn't get a ride from the ambulance to the hospital until the night of January 29th, when I had a heart attack and died for 14 minutes. So this young lady is having abdominal pain and calls, and you really mean to tell me that the ambulance told the 911 people told her that her symptoms weren't severe enough to have an ambulance ride? How do you know what I'm going through? It hurts enough for me to call y'all. How do you know what I'm going through? And then after she was diagnosed with a uterine pregnancy, if she calls again for an abdominal pain and she tells you that she's pregnant, why would you not send an ambulance to her for the possibility of an ectopic pregnancy? I didn't get a ride from the ambulance to the hospital until the night of January 29th, when I had a heart attack and died for 14 minutes. The ectopic pregnancy ruptured my fallopian tube and I was bleeding internally, which caused the heart attack, which caused me to die for 14 minutes. Now I'm in critical condition in the ICU at St. Vincent's Hospital, where they are trying to say I'm brain dead. They don't want to transfer me to a different hospital to give me a second opinion. When I arrived at the hospital, I responded to the test they gave me. My eyes dilated to the light. I had a cough when they cleared my throat for mucus when they gave me the first procedure. I no longer responded to the test, and now they're trying to do a second procedure, and they will pronounce me dead if I don't respond to the test. My mom doesn't want them to do the procedure, but they told my mom they don't need her permission to do the procedure. I don't want to be pronounced dead due to the medical malpractice of these hospitals. Please help me. And then the sister adds, I'm posting on my sister's behalf because I am my sister's voice. I am my sister's keeper. So you mean to tell me, well, who has the authority to, and I'm just asking as a layperson, not even as a medical professional, who has the authority to say that girl can or cannot have the permission? Can or cannot have the procedure? Isn't that up to the next of kin? And if she is brain dead, yes, we're going to do neurological testing to see if she has any, we're going to shine the light, see if the pupils are responding. We're checking a gag reflex to see because, these are neurological things that just happen. It's not anything that we can control. So if there is any brain activity, her brain is going to do that. I mean, her brain is going to respond, and, her pupils will dilate. She'll have the cough reflex, the gag reflex, and whatnot. But I just don't understand. It did not have to get to this. It did not have to get to this. She didn't even know she was pregnant. She was having abdominal pain. She didn't even know she was pregnant. And y'all told her her symptoms weren't valid enough to go get an ambulance ride. So she gets a lift. And y'all don't even run a pregnancy test? Who diagnoses abdominal pain without running other tests? Some diagnoses are what we call a diagnosis of exclusion, like PCOS. There's not an actual test that we can give you that says, hey, yes, you do have PCOS. It's a diagnosis of exclusion, meaning we're looking at other things to see what could be the cause of the symptoms that you're having. And then there's having a brain fart, but I believe it's called the Rotterdam criteria. You have to have 2 out of those 3 criteria for us to say, okay, yep, this is PCOS. But we're running tests to see if it is to see if it's other things before we say it's PCOS. Like, we're running tests to see what's going on in the abdomen. Is it an appendix rupture? Like, is it appendicitis? Is it a rupture? Is it, there's so many things in your stomach. It could be your pancreas. It could be your appendix. It could be your gallbladder. It could be your stomach. It could be a lot of things. But number one, in a person of reproductive age who is sexually active, it could be pregnancy. Whether it's intrauterine, where it's supposed to be, or whether it's ectopic. And if it is ectopic, we need to figure that out and remedy that real quick. So the fact that y'all didn't do a pregnancy test on this girl, shame on you. The fact that after she went to another hospital and got a pregnancy test and then was still having the pain and y'all didn't think, oh, let's do an ultrasound and see what's going on. Like, this girl is in, this girl's family has been told that she's brain dead. Beautiful young lady has been told that she's brain dead because y'all failed to do the minimum. And that's why that's why we gotta have people. I mean, let's just be real. You take care of your own. And I don't want to be like that. I'm going to take care of any patient that comes before me. But my folk, I got y'all. Because you Kendrick say they ain't like us, but honey, they don't care about us. And it's sad that they don't care about us. It's sad that we talk about the crisis in maternal health care and Black maternal health care in my program so much. We talk about the healthcare disparities of Black people so much. And I know my school ain't the only one that's talking about it. So why is it still happening? They literally know that some of these medical books say that Black people are different and they need to be on certain medications and they can't take certain medications, and that Asians are different and they have certain things going on in their blood, and they say that in these books, and then they teach it in medical school that it's not accurate. So why is it still in the books and why is it still being taught? Because then these people go into these healthcare settings and they treat people according to what these old ass books say. And y'all killing people without needing to. People are getting pregnant and not knowing that they're pregnant, and they're not making it out of there alive. And that's a really, really sad thing. Pregnancy is supposed to be the most joyous time of your life. And these babies being born without mamas. Because people aren't taking people serious. Because if I say I can't breathe, damn it, figure out why I can't breathe. If I say my stomach hurts, figure out why my stomach hurts. If I say my leg hurts, put a Doppler on there. Look at my legs. Are they the same color? Is one red? Is one swollen? Does one feel warm? That shit is not normal. Quit telling these women that this stuff is normal. If they're shaky, yeah, you might get a little chilly after having a baby. Yeah, you might sweat a little bit. But these people, normal is a thing. Abnormal is a killer. And y'all are letting these women die for no reason. Because you're just brushing them off as, oh, that's normal. Normal for who? Normal for her? Because that shit ain't normal for me. So, we got to do better. But I just want to shed a little light on this story because it really touched my heart. And I'm praying for this young lady. I'm praying for her family. And we got to do better. We got to do better. But thank you all for watching, and I'll see you guys in the next video.